I am here with Haley Vilhauer, our nutritionist here at Vancouver Wellness Studio. I'm Crystal Meyer, the massage therapist here of the team, and we are doing a series about chronic pain and how each of our practitioners approach chronic pain and how that might be related to COVID. So I'm going to ask Haley a few questions here. And let's go ahead and start with Haley, how do you approach chronic pain?
Oh, I love this question, Crystal. Well, from a nutritional standpoint, because as a dietitian, I have always said it's never just about the food. But of course, my nutrition brain definitely goes to that conversation around input. What's coming into the body? What are we absorbing, both from a food, from a beverage? What are we watching? What are we listening to? What's our environment allowing? And with that, kind of assessing that input and taking note of that is a definite piece of my practice so that I can better understand where my clients are at with what their body is absorbing, if you will,
Yeah.
or ingesting might be a better way of saying it. And so, in that, I always want to get to know the story of the individual because what they're taking in and what they're putting into their vessel matters a whole lot.
Mm,
And it can start to provide some clarity and some understanding as to how they're currently feeling, what their current symptom presentation may be, what their state of, even energy or mood might be relative to what they're inputting. And so for me, chronic pain, we always kind of have to go back to it's never just about the food. But what we're inputting into our body makes a dramatic difference in how our body is going to be able to work with repair and recovery and cell turnover and all the things that influence pain.
yeah.
So I love, with chronic pain to kind of get to the root of what's normal for you, what's coming in consistently, or what are your habits or routines that you keep around the things that you're ingesting,
Yeah.
because that can really lend us a more intelligent conversation about the pain that one might be experiencing.
Yeah.
From that, I always love to say, pain and inflammation are buddies. And
Yeah.
so where there's pain, there tends to be, from a physiological standpoint, at least, we won't go into the psychology of it all, but like from the physiology of the body, where there's pain, there's generally inflammation.
Hmm.
So in my practice, I love food inflammation testing. I think it's a fantastic tool to do some blood testing to get to know
Yeah.
what is your body doing on an innate immune level. How is your immune system responding to the influence of the food that you're putting in it? And
Mm,
that allows us this picture of understanding on a different level of, again, this pain that someone may be experiencing, whether it's headaches or digestive distress, or again, just like tenderness to the touch or an old injury that keeps flaring up or just really seems chronic in nature. When we go back and we start looking at that influence of food, we're able to just understand much better what the body is doing with the involvement of nutrition. That kind of makes sense.
yes. Yes. I think what really stands out to me is, you're talking about what we're ingesting and not just on a food level, like how we're ingesting our environment and kind of like taking things in, and then our kind of our essential response, like with the immune system, like there's nothing more personal than our own immune system. And so I really appreciate how you laid that out. Okay, so next question. How are you seeing the impacts of COVID affecting your clients with chronic pain?
Hmm, that's a great question. I think there's something we probably could agree on with COVID, and that's created more stress for most everyone that we have encountered, whether it's ourselves personally, or family, or our friendships, and then of course the clients that we get to serve and spend time with. It seems as though that stress from a psychological standpoint, for some of us, from a physical standpoint, because maybe our work environment has changed entirely. Maybe we're working at home in a less than ideal work situation. Maybe we don't have a stand up desk. Maybe there are things that have
Mhm.
changed about just the physical nature of how we spend our days. But I know that this stress has promoted a lot of I want to say coping habits is the term that I use, where I'm feeling stressed and so I do this thing in an effort to feel less stressed. And for a lot of us humans, it's food, right? We
Yes.
eat as a response to the stress that we are encountering.
Oh, I am,
And
yeah.
right, I say, just because I'm a dietitian doesn't mean that I'm not a human. So I also have these same struggles, and I have the same awareness during this last year, especially with this pandemic being a thing. We are witnessing people's stress responses and that interconnectedness, that relationship that they have with food. And I think you and I both know that the comfort foods are those that drive dopamine. Those are the, you know, high carbohydrate, high sugar, high salt, often high fat foods that instantly promote this uptake of dopamine, the feel good chemistry in our brain. So, of course, in the moment, it feels amazing. And we're getting some soothing benefits, even, and our brain chemistry is, changing as a result. But you and I also both know that the downside of that is that doesn't last very long. That dopamine is like a quick little light switch. And when it wears off, we have this desire, I call it repeat offending, where
Mm,
that felt good. Now I feel like I need to repeat that again.
yeah.
Even though that thing might not have been the most supportive for me, right? In the moment, it produced something that my body was after, which was that really good dopamine uptake. So I've seen my clients,
Mm,
and they have admittedly so been struggling with the stress that then drives them to these dopamine uh, promoting foods. And oftentimes those are not the ones aligned to give them the best energy, or to give them the most mental clarity, or to give them, the least amount of inflammation in the body.
yes,
Some of
yeah.
the things that would naturally help promote the stress response. So
Mm,
in my practice, it's shown up in the form of more emotional eating, and more of this understanding that, we are complex beings who respond to the stress that we're under in a variety of ways, and each of us has unique stress responses. Each of us has unique triggers, that cause the stress. But universally and kind of globally, I think we could all say that stress has affected some of our behaviors. And oftentimes the behavior I'm seeing most affected with my clients is that of their food choices,
mhm,
and using that food to soothe,
mhm.
because it is an effective tool in the moment.
Right.
And so we've really been spending time, at least in my practice, talking about our relationship with food
Yeah.
and other supportive stress reduction practices that they could get back in touch with, or that they could get to know a little bit better, or that they could try first before they go to the pantry. And it's that awareness that this is an ongoing practice, right? This isn't just for right now when we have maybe a more acute amount of stress than a lot of us have encountered. But this is something for, like, call it a lifetime habit, where
Yeah.
this is going to serve us for the lifetime, to consider our relationship to food, our emotional responses that we may have, that drive us to food. So
Yeah.
yeah, that's one way it's been showing up big time. Is I talk a lot about, not just the food itself and its nutritional value, but just how that relationship is going with that stress response.
Yeah. Mm. I appreciate how you lay things out in such an approachable way. It makes a lot of sense.
Thank you.
Yeah. Um, okay, we have a few minutes left here and I have a few questions left, and I I feel like we just touched on it a little bit that, there's this is an ongoing conversation that we have with our bodies, like lifetime habits. And so, with that, what do you feel is the most important thing for people to understand about chronic pain?
Mm. Oh, that's a good question, Crystal. The first thing that comes to mind, what I would love my clients to understand, is that your pain matters, and it's
Mhm,
not to be ignored or stuffed down, or disregarded as unimportant.
mm,
That it's meant to promote curiosity, I would like it to, as a practitioner, I would like my clients to just have this curiosity about, why is my body presenting with this particular
mm,
thing, this ailment, or this ache, or this, distress, because that allows us to approach our body with a little bit more compassion
Yeah.
instead of just frustration. And I know pain, I have a chronic degenerative foot condition. I understand pain,
Mm,
but I also know that pain is really easy to compartmentalize and say, "Oh, that's just my foot. It's just my foot pain,"
mhm,
and really kind of disregard that interconnectedness that
mhm,
that pain has on all of the happenings in the body. And so, with that, I always encourage my clients, leaning into what is not feeling well and just being a little bit curious about it and having compassionate curiosity with ourselves
mm,
to try and understand, what is the body wanting or needing for support,
yeah.
and or what may have antagonized the body to cause this pain,
Mhm,
and that kind of curiosity as to why we're experiencing what we are in the moment or in the day or in the week or however long, whether that's acute pain or more chronic pain. When we apply that curiosity to self, it
mhm,
allows us to go a little bit deeper into understanding the things that might drive us
mhm.
into that pain cycle.
Yeah.
And for me, I've had to pay really good attention to not just physically not overdoing it with my foot pain, but
Mhm,
also, again, nutritionally. Am I taking my omega-3 fatty acids? Am I taking the supplemental support? Am I
mhm.
getting in the proper amount of nutrients that my body might need
Yeah.
to do the regeneration? And so I love for pain to kind of promote this curiosity that then allows us to go a little bit deeper under the surface to
Mhm,
explore where that may be coming from, what's triggering it, what's promoting it.
mhm,
And that just brings into conversation, this idea that, inflammation is not always a bad thing.
mm, mm.
It does serve, protective functions,
Yeah,
combating infection, absolutely. So
yeah,
we do need some inflammation and free radicals for our bodies,
yeah,
but it is really about balance, right? And
yeah,
so if that balance feels like it's getting tipped to the point where, if I do a hard workout, the
yeah,
normal response of my body might be to be a little bit stiff or sore the next day, especially if I didn't mobilize or didn't stretch properly or didn't hydrate properly.
right.
If that pain, if that is not just a mild response to what was assumed the day before,
Mhm.
why is that happening? So it is all about
Wow.
that balance and kind of really identifying that, you know, pain is something that we oftentimes promote without meaning to. But that, inflammation isn't always a bad thing. It can be protective in a sense, and it can actually even be something we anticipate
Yeah,
depending on what it is that we're putting our body under.
yeah.
Uh, that all makes sense?
Yeah, I mean, Haley, I think what's really striking me just in listening to that is the curiosity piece and the lens that you offer clients because I think that like you said, pain can so easily be compartmentalized and something that we just want to shove aside and say here is some pain management in the form of a pill or ibuprofen or we really are kind of taught to ignore and disregard our pain. And so with chronic pain, I think there's kind of this even more difficult layer that we have to get underneath, which says your pain is saying something,
Mhm,
and here's a lens of nutrition to
mhm.
see how that might affect the pain that's happening in your body. And
Yes,
then inadvertently, Haley, that sounds like a huge lifestyle shift.
yeah,
And like that we discover things about ourselves when we're really paying attention to what we're ingesting, I mean, literally and figuratively. And even just the act of listening, I think, my friend Kathy and I coined a phrase I think you're going to really, really love. Recognition is the currency of healing.
oh, that's good.
And
I
so, like,
love
when we
that.
give
I need to write that
ourselves
down.
yeah, when we give ourselves that recognition, like, "Oh, I'm recognizing that when I eat this or when I don't go to bed at a certain time or when I don't mobilize this area,
Yep.
these are the things that are happening," and it can help shift our actions. And I also wanna say too that, like, there's a way that how you're talking about it provides a sense of agency with a client and not feeling so oppressed by the chronic pain. Because I think, what's hard about chronic pain is that this might be something that we are working with for, the entirety of working together, but mitigating those levels, is something that we can do together. So,
Definitely. Yeah, that's such great wisdom and wrap up there. And that piece of pain is, it's easy to get alarmed by it. It's easy
Yeah.
to be frustrated or upset by it. But I always say, like, our pain is trying to tell us something. And so it's that moment of pause that we can allow ourselves to just not be impatient with the process that our body is going through, that
Mm,
whatever provoked that pain,
mhm.
probably wasn't just an instance, but yeah, just that patience that we need to apply to our body. We can have the wisdom and we can be listening and kind of tuned in, if you will, to the body. But we still do need to apply some patience with the process of coming out of pain. And that's where, I mean, I love our support team, because obviously we know there's no one angle of approach that's necessarily going to be, the magic thing. But it really is this multitude and this interconnectedness of, where is there a lack and where is there a need for maybe some additional support.
Mhm.
And sometimes it is nutritionally that we need to put some things into the diet, or that some things need
Yeah.
to come out. But other times it's like, hey, maybe some physical touch is the answer, and maybe you can't move that inflammation or that pain on your own. And that's such, my encouragement, and kind of the final wrap up is that, yes, we want to be patient, we want to be curious with the body, but we also want to be quick to recognize that we need others, the help of others, to alleviate some of that pain is the answer. And it's so fun to watch and witness when someone gets the right support, and
Yes.
all of a sudden they're seeing this alleviation of something that they felt was a huge burden. And pain is a burden,
Yeah.
and it definitely can be. So yeah, I love that we have a way for people to get supported out of that.
Yes. Haley, it's been a pleasure talking with you today. Thank you so much.
So I always love our chats.
Me
Thank
too.
you for your time. I will look forward to talking further. Have a great
Yes.
rest of your day.
You too.
Bye.
Bye. Thank you for joining Haley and I today. If that is something that just really sparked curiosity and the desire to learn more about how we work as a team or about how Haley works individually, please reach out. You can send us an email, give us a phone call. All of that information is on our website, and each practitioner provides free 15-minute consultations. Thanks again.